Hello, and thank you for watching. This is a short summary of our study, published in the Korean Journal of Radiology. The title is Multicenter Study of MRI Features in Uterine Myxoid Leiomyosarcoma, Revealing and Overcoming a Critical Pitfall in Current Consensus Criteria. Uterine leiomyosarcoma is a rare and aggressive tumor. Myxoid leiomyosarcoma, which we will call MLMS, is an even rarer subtype. It is defined by abundant myxoid stroma, which has a very high water content. On MRI, current consensus criteria help separate malignant from benign uterine smooth muscle tumors. A key part of these criteria is diffusion restriction. In simple terms, malignant tumors are expected to show a low apparent diffusion coefficient, or ADC, because of their high cellularity. Here is the problem. Because myxoid leiomyosarcoma is rich in myxoid stroma and water, it shows high ADC values, not low ones. As a result, it can look like a benign tumor on diffusion-weighted imaging. This is a dangerous pitfall, because an aggressive malignancy may be mistaken for a benign leiomyoma. The aim of our study was to reveal this pitfall and to find practical ways to overcome it. This was a multicenter study of 38 women from 12 institutions. 15 had myxoid leiomyosarcoma, and 23 had conventional leiomyosarcoma. 3 radiologists reviewed the MRI features. We assessed qualitative imaging features, quantitative ADC values, and whole tumor histogram analysis. Now to the quantitative findings, and the core of the pitfall. When we applied the current consensus ADC criteria, 10 of 12 myxoid leiomyosarcomas, that is 83%, were misclassified as benign. Even in the most diffusion-restricted part of each tumor, the ADC of myxoid leiomyosarcoma stayed higher than that of conventional leiomyosarcoma. So ADC alone is not reliable for this subtype. We then performed whole tumor histogram analysis. As shown on the right, myxoid leiomyosarcoma had a higher whole tumor T2 signal ratio and a higher ADC. The mean, or raw, ADC was the best discriminator. So how can we overcome this pitfall on routine images? The key is a sign we call the marbled appearance. This is a swirling, marble-like pattern on T2 weighted imaging that reflects the myxoid component. It was present in 73% of myxoid leiomyosarcomas. Most importantly, among the 10 tumors that the ADC criteria misclassified as benign, 8, that is 80%, showed the marbled appearance. So this simple visual sign can rescue the diagnosis when ADC is misleading. Alongside the marbled appearance, the overall T2 signal pattern is also informative. On T2 weighted imaging, myxoid leiomyosarcoma showed 3 patterns. Some tumors were purely T2 hyperintense. Others showed a mixed pattern. And some were only T2 isointense to moderately hyperintense. Overall, a purely or mixed hyperintense appearance was common, seen in 80% of cases, that is 12 of 15. In contrast, conventional leiomyosarcoma was usually ISO to moderately hyperintense. So when a uterine mass shows a high T2 signal together with a marbled appearance, myxoid leiomyosarcoma should be strongly considered, even if the ADC looks benign. Here are the take-home messages. 1. Do not rely on diffusion restriction alone. A high ADC does not exclude malignancy in myxoid leiomyosarcoma. 2. When you see a uterine mass that is purely or mixed T2 hyperintense and shows a marbled appearance, keep myxoid leiomyosarcoma in mind, even if it looks benign on ADC. This study has limitations, including its retrospective design and the small sample size, which reflects the rarity of this tumor. Even so, to our knowledge, this is the largest imaging series of uterine myxoid leiomyosarcoma reported to date. In conclusion, current ADC-based consensus criteria can systematically miss myxoid leiomyosarcoma. Recognizing the marbled appearance and not over-relying on diffusion restriction can help avoid this critical pitfall. Thank you very much for your attention. We hope these findings are helpful in your daily practice. For more details, please see our full article in the Korean Journal of Radiology.